I watched a couple of the episodes and it was very inspiring actually, and I was like, oh, I didn't expect this.
Yeah, there were a lot of pleasant surprises, I have to say.
And they seemed really like normal people who just said, I never looked, I don't look the way I feel inside, and I just want my inner to match my outer.
That's a typical complaint, especially as people age. They go, I feel like I felt when I was 30 years old, but I look like I'm 65. And it doesn't sit well with me, and maybe I could do better at work or do better socially or just feel more confident in myself if I looked younger and looked better. Those are good candidates for plastic surgery. And many people, I still recall sitting in the preoperative room preparing to mark a patient for surgery and have the woman in this particular case, who remains a friend of mine, say, you know, I've waited 31 years for this procedure. In her case, it was a breast lift and a breast augmentation. When you think about a 16-year-old feeling poorly about their body shape and image, how it affects them and how it affected their life and their self-confidence, and in the course of 2 or 3 hours to be able to dramatically change that, it's a very powerful tool.
Absolutely.
So it has to be applied selectively and carefully, and you know, sometimes we make mistakes.
Okay, so let me ask you this.
Yes.
How do you deal with the God complex? Because you are kind of playing God in there.
Well, I don't think I have that issue. I'm very much aware of my own shortcomings.
Yeah,
and the
you
limits.
do. You're very easy to talk to be with. You're very approachable. But how do you not get an ego of saying, look, I could work on brains, I could change faces, I could, you know, that's a...
No, it's interesting because you do it every day. And I think that there are people who perhaps get a God complex.
Yeah, most. When I've talked to surgeons, they're especially plastic.
Egotistical.
Oh, very much so.
Well, I think the majority...
And they try to be intimidating to others. And
see, I don't like that type of personality. And I know people who are very pretentious and arrogant, and you know, patients sometimes leave their office crying, and that's not the way I like to operate. And I think that's not admirable at all.